Hello, I'm a research nurse. I'm a trained nurse who also helps to run clinical research studies in the intensive care unit, or ICU. Clinical research is how the NHS improves treatments for patients and increases knowledge about health and care. Over 99% of NHS trusts in England support clinical research. It's an everyday part of what we do. GPs, hospital doctors, nurses, paramedics, physios, everyone wants to improve the care they provide to patients, including in the ICU. Over the last decade, clinical research has changed the way we look after patients. For example, although life support machines are life-saving, we now know that traditional ways of ventilation were damaging the lungs. As a result of the ARDSNet study, we now use less volume and pressure for each breath to prevent damaging the lungs. Using this way of ventilating people has improved both short-term survival and long-term quality of life. We support many different types of studies in the ICU. All have to be approved by an independent ethics committee that reviews the risks and benefits to patients. We'll only ask patients to join a study if their doctor thinks it's okay for them to be in it. Of course, usually a patient needs to agree to take part in a research study. This is called giving consent. Before asking for this, doctors will take into consideration the patient's condition and the timeline of the study. If that's all okay, then a research nurse or member of the study team will discuss the research with the patient. Typically, we'll give the patient an information sheet and answer any questions they may have. A patient can say yes or no. Either way, it won't affect their quality of care. If they agree, they will be asked to sign a consent form. If they consent but decide later that they don't want to take part, they can leave the study at any time. Asking for consent in an ICU can be more challenging than in other places. That's because patients can be seriously unwell and may not be able to speak for themselves. For example, they could be sedated or too unwell to understand what's being asked of them. With these patients, a research nurse or member of the study team speak to a family member or close friend. We'll give them an information sheet about the study and ask if they think the patient would like to take part. If the relative or friend believes the patient would say yes, we'll ask them to sign a consultation form. Later on, if the patient is feeling better, a member of the study team will talk to the patient to see if they want to stay in the study. Some studies have narrow windows of time to include patients, so a doctor might have to talk to family members about the research very soon after the patient's admission. If a relative or friend is unavailable, we'll ask a doctor, one who is involved in care but not the study, to give consent. Later on, if the patient is feeling better, a member of the study team will talk to the patient to see if they want to stay in the study. Whether you're giving consent for yourself or for someone else, it's important to remember that the study will not necessarily lead to a better health outcome for the patient. But crucially, it will increase our knowledge, which may improve treatments and care for critically ill patients in the future. If you have any questions about research studies, don't hesitate to ask. We'd love to talk to you about what we do. For more information about clinical research, visit the National Institute for Health Research's website at www.nihr.ac.uk.